Hello and welcome to Askimo TV. I'm talking today to Dr. Prasad Kothari. Dr. Kothari is a consultant ENT, head and neck surgeon in the UK. He has a special interest in head, neck and thyroid cancer, as well as sleep apnea and snoring. Hi, Dr. Kothari. How are you?
Good morning. I'm very well. Thank you.
Great. Dr. Kothari, let's talk today about thyroid cancer. So I'd like to start off with, what is the thyroid?
Okay, the thyroid is called the endocrine gland. It is the largest endocrine gland in the body, situated in the neck. Thyroid is a word which is derived from a Greek word which means a shield. So it is shaped like a shield in front of the neck. The function of the thyroid gland is to secrete what's called a thyroid hormone. And the thyroid hormone is something that controls your body metabolism. So it is an essential part of an endocrine function is to maintain your basic metabolic rate.
So what happens to the thyroid when it becomes cancerous?
Now, the problems with thyroid glands are very common, and the commonest problem we see is either an underactive thyroid, an overactive thyroid, or an enlarged thyroid called a goiter. Now, none of these have any implication that they are cancerous because these are very common. The cancer in the thyroid gland is something which may have a small focus in the thyroid gland, so may not cause any symptoms at all. So cancer in the thyroid gland is purely picked up by either scanning and taking some cells from the thyroid gland, or in very exceptional circumstances, when the cancer is very advanced, it may cause other symptoms like difficulty swallowing, difficulty breathing, change in voice. But generally, thyroid cancers are picked up early these days because of scanning and taking a sample. So they may not cause any abnormality within the function of the thyroid gland. So you may have a completely normally functioning thyroid gland, yet have a small cancer, or you may have a cancer in the thyroid gland and your thyroid gland will be entirely normal in terms of function.
What causes thyroid cancer and who would be at risk?
Interestingly, thyroid cancer incidence is increasing, certainly in UK and parts of the Western world. And nobody knows whether this is a true rise or it's just that we are getting better at diagnosing thyroid cancer. Because thyroid cancer may present as a very small, when I say small, I'm talking of a few millimeters of focus within the gland, and it may be picked up on a routine ultrasound scan or an MRI scan. And once it is picked up as an abnormality, it will be tested and confirmed. There have been lots of studies to show that people who have died of old age actually had thyroid cancer in them. And that was just what we call an incidental finding. So thyroid cancer may be present in a lot of people and they may not be aware of it. All it means that thyroid cancer doesn't necessarily affect your longevity. So you may live a normal life even with a small focus of thyroid cancer. It usually picked up on scanning.
Who's at risk for getting thyroid cancer? Could it be hereditary?
Right. There are some thyroid cancers which are genetic or hereditary, particularly something called medullary cancer of thyroid. But the other common cancers of thyroid, which are the papillary cancer or the follicular cancer, these are more common in women, far more common in women than men. They're more common in women in their 30s and 40s. If there's a family history of thyroid cancer, you're at a slightly increased risk, or history of other cancers in the family puts you at slightly higher risk. It's not something which is related to habits of smoking, so it is not related to smoking. However, if you had previous surgery or radiotherapy to your neck for some other causes, it increases the risk. And in a small group of people who are exposed to radiation, either if they were near a radioactive source, for example, Chernobyl, when the Chernobyl explosion took place, there is a slightly increased risk.
How is thyroid cancer treated? What sort of various options are available?
Generally, for thyroid cancer, the treatment is very clear. It usually involves removing the thyroid cancer, and that may include a procedure called thyroidectomy. Now, depending on the size of the cancer, it may include removing only part of the thyroid gland, called a hemithyroidectomy, or the entire thyroid gland, called a total thyroidectomy. Depending on how big the cancer is and where it is, most people will have what we call a total thyroidectomy. Once the thyroid cancer is removed, if the lymph nodes are involved, they may also need what's called a neck dissection with the thyroidectomy. But if it's a small cancer, just thyroidectomy is adequate. But following that, they will need what's called iodine treatment, which is iodine ablation, which is not the same as radiotherapy. This is radioiodine treatment, where they take a capsule and that mops up the small microscopic thyroid cells which are present. And after that, they will need what we call lifelong treatment with thyroxine, which suppresses the hormone that stimulates the thyroid hormone. So it is called TSH suppression. So to summarize, it's surgery followed by iodine treatment, followed by TSH suppression with thyroxine for vast majority. There are some people who may not need the entire treatment, but this is in general treatment for thyroid cancer.
And just to end off, Dr. Kothari, what is the prognosis for recovery for thyroid cancer?
Thyroid cancer has got very good outcome. For early stage cancer or papillary cancer or follicular cancer, which is the commonest types, we are looking at survival rate in high 90s, 92, 93% with full treatment. But it is a cancer for life. So once it's diagnosed and the patient is at treatment, they will just need a routine follow-up, maybe every year. And that includes a blood test to check the thyroid function, because they'll be on thyroid tablets, and also something called thyroid globulin, which is a marker for thyroid cancer. But it's something that will have to be done for life. But the prognosis overall for the common thyroid cancers is excellent.
Thank you, Dr. Kothari. Thank you so much for talking to me.
Thank you.